Good morning and good afternoon. My name is Chris Isom, and I'm with Casey Family Programs. I'm a partnership advisor, and I'd like to welcome everyone to our webinar today, Housing is a Foundational Element of Family Well-Being. Most of you guys have already dropped your name in the chat, but if you haven't had an opportunity to drop your name and your organization in the chat, please do so now. We would like to thank our partnership with Corporation for Supportive Housing and Chapin Hall and the states that participated in this 2025 project. And we would like to be able to also hear from you to hear your additional insights as the webinar progresses today. So please feel free to use the chat. So that we can know what additional evidence might be necessary and what additional tools you all may need as you guys move forward in this very important topic around housing. We know that housing is a key issue in keeping families and children together. If you guys have any questions, please also use the chat feature as well. We will in the Q&A function of the webinar so that we can address questions as time allows. If we do not get to questions during the webinar, we will make sure to address those afterwards. We have a poll that we are going to kick off. So the first poll question is, what sector do you work in? The options are housing and affordable housing, supportive housing, sorry, a little tongue twister there, child welfare agency, homeless response, philanthropy funder, or policy and advocacy, or other. So you have a few moments to respond to the first question, and then we'll go on to the second. Okay, so the largest area we have today is other with 32%. Coming in second is child welfare agencies at 27%. Housing, affordable housing and supportive housing, we have 12%. Folks in the policy and advocacy field, we have about 17%. And philanthropy, we have 3%. And homeless response, we have 8%. Thank you, everybody, for answering the very first poll question. And I think the second one is going to launch here shortly. So what level of partnership between your child welfare system and your housing and homelessness system currently exists in your jurisdiction? So the options are none, low, medium, or high. Again, you'll have a few moments to answer that question before we give the results. Sorry. The answers to the second part of the poll are high is 4%. Low comes in actually first at 50%. Medium is 38%, and none is 8%. So it will be helpful just to know from you all if there is how you guys will use information that you learned today, and also to inform future research and content development. So those things would be helpful for us to kind of hear from you all throughout the day. Thank you for participating in the poll. And we hope that the information that we're able to share with you guys helps you in your individual work in your jurisdiction. So I will turn it over to Maya.
Thanks, Chris. Hi, everyone. Maya Saxena with the Corporation for Supportive Housing, or CSH. And I'm here and happy to give a brief overview of this cohort, the 6-month cohort that ran from June to December of last year, where we were working with four incredible states, Oregon, Colorado, New Jersey, and Kentucky. And you'll hear from them here shortly. And really what this cohort, the structure of this cohort, it consisted of one-on-one technical assistance calls between the state partners, Corporation for Supportive Housing, and our partner Chapin Hall. There were also monthly group calls with all four states and all partners in the same space. And during those monthly calls, each team had an opportunity to spotlight their work at this intersection of child welfare and housing or housing instability. Each team individually identified goals to advance their work at this intersection of child welfare and housing, including things like statewide collaborations, ideas for pilot programs. And again, you'll hear much more about that in the following parts of this webinar. There were four main goals for this cohort, and ultimately, Casey Family Programs, CSH or Corporation for Supportive Housing, and Chapin Hall wanted to create a space of shared learning for state, housing, and child welfare leadership to advance policy, practice, and to better align resources as they serve children and families in their communities. The first goal was to ideate, adapt, and advance upstream and preventative housing stability strategies to better support families and to prevent unnecessary out-of-home placements. The second goal was to have each team and each partner contribute to a collaborative space for sharing and for learning, with special consideration due to the timing of evolving policy and a shifting funding landscape. The third goal was to advance tangible progress, policy, practice, and resource allocation that allows for local implementation and informs scalable solutions that can be used more broadly in the field. And the fourth and final goal was to facilitate a more efficient use of resources and improve the responsiveness of systems that prevent homelessness and ultimately support family well-being. And with that, Sam, I'll pass it over to you.
Great. Hi, everyone. I'm Sam Steinmetz, a senior policy analyst at Chapin Hall and a co-lead of this cohort. We are now going to review key data across various studies on the intersection of housing instability and child welfare system involvement. The compilation of this research comes primarily from my Chapin Hall colleagues, Yasmin Gruel-Koch and Claire Anderson. To begin, while research demonstrates that there is a strong relationship between family economic insecurity and child welfare involvement, it increasingly indicates that families who experience material hardship may be at particularly high risk. Material hardship is generally defined as having difficulty paying for necessities such as housing, utilities, food, or medical care. And this study found that material hardship is a consistent predictor of contact with child protective services, even when accounting for income poverty and other family characteristics. And unmet basic needs pose a remarkably consistent risk for CPS contact over and above income poverty. Research also shows us that material hardship is associated with increased risk for child welfare involvement due to neglect and physical abuse for families who are low income, and that when these families experience cumulative material hardships, it may have a particularly strong impact on child welfare involvement. This longitudinal study found that when families who are low income experience at least one material hardship, they are 3 times more likely to be subject to a neglect investigation and 4 times more likely to experience a physical abuse investigation. And when these families experience multiple types of hardship after not having experienced any, the impact is even greater. They are 7 times more likely to experience a physical abuse investigation. Now for some predictors of child welfare involvement. On the left side of this slide, a recent systematic review found that the most reliable economic predictors of child welfare involvement are income loss, cumulative material hardship, and housing hardship. On the right, you can see which types of hardship are most predictive of investigative neglect reports. Things like food pantry use, difficulty paying rent, utility shutoffs, and inability to receive medical care. So what does the evidence suggest happens when housing supports are reduced? In this slide, you can see that the specific types of housing stress that have been associated with increased risk for child welfare involvement, including child maltreatment, CPS investigations and substantiations, and foster care placement. You can also see the data in the box on the left. It is estimated that families with children make up almost 1/3 of the total homeless population in the US. It is estimated that inadequate housing contributes to the risk of entering foster care for 1 out of every 6 children involved in CPS investigations. The study in this bottom bullet focused on housing instability, which included eviction, residential mobility, and homelessness. It found that self-reported housing instability in urban areas was associated with increased risk for neglect above and beyond poverty. And on the right, you can see that the Children's Bureau recognizes that housing is a prevention intervention. I think it's surprising for many to hear that the population most at risk of eviction in the US are babies and toddlers. A groundbreaking analysis published in 2023 that linked 38 million eviction court cases to US Census Bureau data provides the most comprehensive picture to date of the US population renters facing eviction. In each year, children under 5 make up 12% of those affected by an eviction filing, representing the largest group by age. And in fact, at every income level, households with children are more likely to experience evictions than households with no children. This analysis also elevated that Black children and families are disproportionately impacted by evictions. For example, despite making up only 18.6% of all renters, Black Americans account for 51.1% of those affected by eviction filings and 43.4% of those evicted. And 12.4% of Black children under the age of 5 living in rental homes are evicted each year. So what does the evidence suggest happens when housing supports are increased? This is a study by my colleagues at Chapin Hall. It is a randomized controlled trial that assesses the causal impact of supportive housing intervention for child welfare involved families in Connecticut who faced housing instability. Supportive housing programs provide resources to make housing more affordable and often provide services to people with complex needs to help families stay healthy, stable, and housed. In this study, families randomly assigned to the intervention group received a housing voucher and case management. Families in the control group received services as usual. It found that compared to the business as usual control group, families who received supportive housing experienced significantly fewer removals, a lower prevalence of substantiated maltreatment, and increased reunification. This Health and Human Services supportive housing demonstration found that families with children at risk of removal who received supportive housing experienced fewer foster care placements, improved housing outcomes, and less intimate partner violence after 5 years compared to families who received the usual services. And finally, this is an important new study related to housing insecurity. It found that eviction moratoria implemented during the COVID pandemic were associated with a 21% decline in sexual abuse reports, 16% decline in physical abuse reports, and 12% decline in neglect reports. It compared child maltreatment rates among counties with continuous eviction moratoria to counties that never implemented eviction moratoria. And the authors of the study suggested that the large reduction in sexual abuse reports may have to do with the vulnerability families often experience when they're kicked out of their homes and forced into unknown, potentially dangerous living situations. And now over to my colleague Andrew at CSH.
Great. Thank you, Sam. I'm Andrew Johnson, Director of Systems Transformation for Families and Youth at CSH. And really building from the evidence that Sam just reviewed with us, I'm going to briefly review a few select data points. And I think it should be no surprise to any of us that overall housing stress across the country has really been increasing overall in recent years. And, in this particular report, median rent increased 23% since 2001, yet median household incomes have only increased 5%. So you can see this widening gap that has pushed millions of households into that precarious position of having housing costs that are more than half their monthly income. And then we also see that there are record numbers of people who are unhoused today, including far too many children, youth, and families that do not have a place to call home. Furthermore, as we've heard, a lack of stable housing is a factor for inflow into the child welfare system. And over time, we know there's been positive progress as more preventative strategies, including housing supports, have been implemented. And yet, there's still more work to do. This chart shows only where housing instability was reported as a factor for children being placed in foster care, and there's broad consensus that this is likely an undercount. In addition, it doesn't show families involved with in-home child welfare that have not had their children removed but are impacted. Due to updated federal child welfare data requirements, starting with federal fiscal year 2023, in addition to tracking housing instability, an additional removal circumstance of homelessness was added. So you can see that with the orange line. And child welfare agencies can select multiple factors present for a family at child removal, and yet we can reasonably assume that only some of the families were marked to have both characteristics selected, meaning that total child removals impacted by housing instability or homelessness are higher than what that top blue line would represent at the end there. And that uptick in the trend is consistent with what we've seen documented with increases in family homelessness overall. So Sam mentioned a few different types of housing interventions or strategies. There's a whole range of strategies and interventions across the country. I'm sure you all are familiar with many of them. We also, in the state report related to this webinar today, if you look at Appendix B, there's a housing menu and a housing menu worksheet link with detailed information about what I'm just going to quickly review. But to start kind of level setting, some of the common housing interventions: prevention, which is generally intended to keep families in their current housing, providing services that mitigate factors that could cause an eviction, may include some flexible resources to stabilize family housing circumstances. Shelter, when you hear that term, that's generally time limited, typically anywhere from overnight to generally 90 days. Some jurisdictions have opportunities for extensions, but it's for families that have no other option for temporary or permanent housing. There's generally access to or referrals to crisis services accompanying that. Transitional housing is temporary, usually rental assistance from 18 to 24 months, time restricted, along with some services that are designed to provide families that have low or moderate service needs with interim stability and support that can help them move to and maintain stable housing. Rapid rehousing is intended to help families secure stable housing, initially providing a short-term temporary rental assistance paired with supportive services, usually somewhere between 6 and 24 months time frame. But the goal is that a family continues to maintain stably in their home after the rental assistance and services end. And then we have supportive housing, which we just heard about, which is affordable housing that provides wraparound voluntary supportive services for each family member without a predetermined time frame. And it's tailored to serve families and households that are facing multiple housing stability barriers and challenges such as mental health, substance use, other disabling conditions, complex histories such as systems involvement, trauma, violence, etc. And then last on this list, we have affordable housing. This is a term covering actually a variety of different housing options and rental assistance types across different affordability ranges that are generally related to some percentage of people's in relation to the area median income. And housing is typically considered affordable when a person or household doesn't pay more than 30% of their monthly income towards their rent and utilities. So that's just a little overview. Those terms get used a lot, so hopefully that's helpful. All right, so now we are going to shift with all of that background and evidence and data in mind, and we're going to look at what's happening in the field. So I think with that, We are very pleased to be joined by cohort representatives, each of whom are going to briefly introduce themselves, and then I'm going to ask each of them one by one to share a brief state overview, and then we're going to move into a panel discussion. Just I would note that in addition to this wonderful group of state leaders joining us today, each state team that participated included multiple state roles and partners. We certainly encourage you as we start moving into this to be thinking of your questions and share those as well. And there's a note in the chat about how to do that. So I think with that, I will have why don't we have each person introduce themselves as we kind of go through, but you can see on the screen we have Janelle Winter, Stacy Mailer, Evan Castor, and Mary Carpenter from our four states. Sorry. Actually, why don't I have each of you just quickly introduce yourselves, and then we'll have you do your state overview. So I'll start with Janelle. You want to introduce yourself?
Hi, good afternoon, everyone. I'm Janelle Winter, Assistant Commissioner and Director of the Division of Housing and Community Resources at our New Jersey Department of Community Affairs, which is our state housing agency and statewide public housing authority.
Great, thank you. Stacy?
Sorry about that. I was trouble getting up myself off mute. Stacy Mailer, Housing Coordinator, Oregon Department of Human Services, Child Welfare, Family First Program.
Wonderful. Evan?
Hello, Evan Castor, Deputy Director for the Division of Housing for the Colorado Department of Local Affairs. As part of the cohort, I was part of the Colorado Department of Human Services, where we also joined by the Colorado Department of Early Childhood. Thanks for having me today.
Thanks, Ellen. Mary?
Hello, I'm Mary Carpenter. I'm an executive advisor with the Department for Community-Based Services in Kentucky, which is part of the Cabinet for Health and Family Services, our broader agency within Kentucky. And my background is in child welfare. Happy to be here. Thank you.
Thanks, Mary. Thanks, everyone. All right, let's shift to New Jersey. Janelle.
Thanks. So a few of the programs and innovations that we have in New Jersey that I think have really impacted the partnership between our New Jersey Department of Children and Families, which is our child welfare agency, DCA, our housing agency, and our Department of Human Services. Include one is the development of the New Jersey Department of Children and Families Office of Housing. So embedded within our child welfare agency is an office that focuses on housing from the perspective of the child welfare side, which is a really great connection for all of our agencies to be able to connect around housing. And that office kind of serves as a translator and a liaison between the housing agency and the child welfare agency, because we sometimes don't speak the same languages. Also, that's played a major role in our Keeping Families Together program, which is our partnership with DCF, where we provide supportive housing and services to more than 600 families. That is a mainly state-funded program. We at DCA administer the housing, DCF administers the services. We also have our state Office of Homelessness Prevention and our state Office of Eviction Prevention, both of which are housed at DCA and give us a lot of great data, best practices, and elevation of what's going on the ground in those areas here. Some of the next steps that we're pursuing as a result through this cohort and then as a result, one is really expanding the data that we share across agencies. We already had a really, I think, high level of sharing, but we really want to make that not just an ad hoc project, but an institutionalized method of doing that. And so we're really working to make sure that that becomes just part of how business is done. And we use that data sharing and our coordination to work on joint messaging and education about these issues, including to policymakers. And that's something that's really key, and we hope to continue to use to make sure that we can secure the funding we need, especially right now when it's a transitional time for funding at the federal level. And we also are in a transitional time here in New Jersey where we have a new governor this year.
Great. Thanks, Janelle. All right, now let's move to Oregon. Stacey.
Hello there again. So again, I am part of the Family First team in child welfare, and I think that we're really well suited. This team and I, even though I'm not focused on the same evidence-based practices that they are, our values align and our shared mission aligns. So we really are looking to reduce foster care involvement safely and equitably, and doing so by making sure that the services are available to people and available as accessible as possible. My role is specifically to reduce housing barriers for families engaged in child welfare and young adults exiting care. And I believe that by increasing awareness, education, and service orientation towards long-term stability, we can strengthen well-being, stability, community connection, and family preservation, all of us which are going to help reduce the need for child welfare intervention. Because mine is a time limited role, we sat down and kind of talked about, based on my experience and the broader landscape in Oregon and nationally, what kind of things could we focus on. Identified a ton of needs, no ability to do all of the things, but focused on a few specific things. And one of them being the Medicaid 1115 waiver. The housing benefit was starting here about 6 months after I started. So I was able to engage in those conversations and bring a child welfare perspective to that dialogue. And those conversations go on to this day. We are certainly hoping to renew that waiver and make some traction that will be more specific to child welfare populations. Another area was the foster youth independence vouchers. Because those vouchers are available non-competitively, this represents a really strong area for growth. And so this, has the other effect of also continuing to engage more people with their public housing authorities. And I think that's a win-win. So we have expanded FYI vouchers, but even if we hadn't, the relationship building, I think, is a really big asset. Housing, education, and training. So we're not a housing agency. We haven't focused a lot on that. There's not a lot of trainings in our system in regards to housing. And so something that I felt like I could do really quickly is making sure that we got trainings. So just bringing statewide housing trainings, hosting like a panel of public housing authority directors, or any staff with a lot of skill and experience, could come in. But we had a few directors that were willing to do that. The Fair Housing Council here in Oregon, and a bunch of other different providers that were kind of statewide ways to enhance the knowledge within both our child welfare and our self-sufficiency programs. And we kind of have that open to all of ODHS as well as our contracted partners. Simultaneously, we talked about paying for an external training, and ultimately we're moving forward with developing some internal training. So we have two in the works that we're developing, and we expect it to be a series in regards to housing. And we also continue to do the hosting of trainings monthly. And I say we just because I, get partnership where I can find it. I interface with a lot of different public agencies. We do have I have an ability to do that other people don't, because my position is so housing focused. So I know a lot of people within our agency that know a lot about housing or are interested in housing, but they don't have the bandwidth to do it. So it's been great to have that intentionality and work for to do this. So one of the programs I collaborate with is our Youth Experiencing Homelessness program. And they're serving 14 to 24-year-olds in the community. We have been able to collaborate on community outreach, on training, on work groups, on pilot projects. We have two pilot projects, one that is going for FYI housing navigation, and another that is targeted housing assistance for former foster youth. And those have been great experiences, and we hope to get some great data and information out of them. And then external partnerships, as I said, particularly with public housing authorities, this has been a big one. And then also relationships with HUD, because it has really helped when some public housing authorities are reluctant to start, say, with FYI vouchers, to be able to get them answers, to be able to know, like, hey, if you need me to, I can follow up with HUD. I can get those answers. I'll get that in writing for you, and so that even if you're in shortfall, you can get these FYI vouchers. That can still come through. And so being able to have those conversations and feeling like that can lead to other things. It can lead to training. It can lead to, when there's other funding opportunities, they think of us, they know us as a trusted partner. That's how we move forward. And then I will just say, lastly, I think that this is To me, the goal, again, knowing that this is time limited, knowing that there's a limited impact I can play as one person, just to talk about how we do this intentionally, how we do this, knowing that housing affects everything else that's going on in child welfare. Families can't help but be impacted by their housing. So if we're pretending it doesn't exist, and lowering it on our priority list, we are really doing our families a disservice, and we're doing ourselves a disservice in terms of working with people. So we want, we're first to acknowledge we're not a housing agency. It's never going to be our first skill set, but improving our ability to engage in trauma-informed conversations about housing so that families can remain together, reunify more quickly, and maintain community connections, and improve their overall well-being is the ultimate goal. And if I can make some small step toward that, then I am really grateful.
Thanks, Stacy. All right, let's move to Colorado. Evan.
Great. Thanks for the opportunity. I think just want to highlight at the outset here, this was such a wonderful opportunity for us as a state to learn from all of these other key state partners. So just really highlight the importance of this opportunity, seeing the chat here and all the enthusiasm for these populations that we're supporting. Just want to really give a shout out to the importance of this and learning through these bold and innovative collaborative solutions. So in Colorado, during the cohort, this was made up of our Colorado Department of Human Services and Division of Child Welfare, as well as our Colorado Department of Early Childhood and Office of Program Delivery. What we were bringing was, we'll speak through 3 of those sort of program and innovation areas and also highlight some of the next steps that we have. And just noting that all the work that we're really prioritizing here in Colorado is to leverage those both public and private partnerships, as well as their strengthening our interagency, which means between the state departments of service deliveries, how we can work together to make sure that we support young adults across the state. So one of those areas of program that we want to highlight was the work that we did with our Family Stability and Housing Alliance, which was established in 2024. This is a cross-sector early childhood initiative with the goal of collaborating across sectors in early learning, public health, human services, housing, and policy to identify ways to support families with young children who are experiencing housing instability. This group was recently awarded a grant award to really support the prenatal to 3 population and really delivering those collaborative solutions across the state. One of those areas that we really want to continue to grow in Colorado. 2 other areas focused on foster youth transitioning into adulthood. First, noting a program that we developed in the last several years, Colorado Fostering Success Housing Voucher. This is an innovative partnership between our Department of Human Services, Division of Child Welfare, as well as the Department of Local Affairs, Division of Housing, focused on delivering housing and services attached to former foster youth as they transition to adulthood between the ages of 18 and 26. This is working closely with our county partners as well to deliver those Chafee transition services across the spectrum, and also supportive housing, as we heard from the top from our Corporation of Supportive Housing Partners, how important that key intervention is for us as a state and prioritizing those funds. Also highlighting the work that we have for our Chafee Foster Success Program for a successful transition to adulthood. This is part of Colorado's Chafee program, which generally provides support to help youth currently and formerly in foster care successfully transition to adulthood. Colorado's created the Colorado Foster Youth Success Transition to Adulthood Advisory Board, which is made up of a board of county and state employees, as well as Coloradans with lived expertise, and also representatives from a runaway and homeless youth provider network, who really review those programmatic functions and make decisions and recommendations for how we can deliver the Chafee program and services across the state, which focus on transitional services supporting youth 14 to age 26. One of those unique opportunities that we're really highlighting here in Colorado is our Pathways to Success, which is a partnership with the Division of Youth Services, supporting youth in detention commitment, and developing a model, which we call Pathways to Success program, which engages transition age youth in a coach-like way, which is a really important model as we really find the ways to meet the youth across our state. Highlighting some next steps for us as a state, one area that we're continuing to invest in and see additional support is increasing capacity for our family resource centers. So we have a network of 35 family resource centers in rural and urban areas of the state that serve as the front door for coordinated access and entry and referrals to response to family strengths, needs, and resources and barriers. And since 1989, the Colorado Family resource centers have participated in the association, which hosts quarterly training and capacity building efforts to build that across the state. We had an example last year with one of our local partners who moved one of their programs, a former school, into transitional housing for family apartments. So really unique opportunities to meet the needs of our populations here in Colorado. One more area that I want to highlight for us, and this was just recently launched here in Colorado, that during May, in observance of National Foster Care Month, the Division of Child Welfare at the Colorado Department of Human Services has partnered with our 211 Colorado to launch a new pilot program called the Warm Line. 211 Colorado is a confidential multilingual helpline that connects people across the state with local services. These services include housing, shelter, food assistance, and health services, as well as mental health, substance use support, pregnancy and parenting resources, and services for children and youth with special needs and financial assistance. This is a key partnership that came out of our Reimagining Colorado Child Welfare System initiatives, which was a group made up of investments from the Kemp Center, Department of Human Services in several of our counties. And this group has really made those recommendations to bring this warm line to life here in Colorado. So excited for next steps as we are continuing to work and strengthen those partnerships across the state. Thanks.
Thanks, Evan. That's great. All right. Kentucky, Mary, you're up.
Thank you. I appreciate the opportunity to be here today. In Kentucky, we used the cohort really as an opportunity to be more intentional, which you've heard. You heard Stacy mention it. You've heard it from a lot of my other presenters here today, but really about how housing instability and homelessness fits into our broader family well-being efforts. You can see here some of our innovations. We lifted a division of prevention and community well-being several years ago. So just thinking about as we are continuing to shift towards a system that is focused more on strengthening families and addressing challenges, how we can be more intentional about housing, because it does impact the families that we serve. So Kentucky is really working to build that family well-being system that supports families earlier, before those challenges are escalating to the point of child welfare involvement. So we've expanded those prevention services. We're expanding those community-based services and supports, and we're implementing alternative response. We're working on implementing community response, which you can see here, opportunities for prevention and transformation, which is opt-in. It's a partnership with the Doris Duke Foundation to provide resources and supports to families earlier. And we're thinking about housing in those prevention efforts. So as we're thinking about those existing supports, thinking about really where housing shows up, looking at our data more intentionally, and even thinking about data in terms of foster care. We are seeing in our data an increase in children entering out of home care where housing instability is a contributing factor. And really through this cohort, we were more intentional about looking at the data. And so the cohort prompted us to really ask some questions about how we're identifying housing needs, how we're supporting our staff. So thinking about those training needs, and thinking about barriers for families. And when we're trying to get children home sooner and safer, thinking about barriers that families are experiencing around housing. So through this cohort, as far as next steps, we really are thinking about integration around screening. We are serving the same families on the housing side as we are on the child welfare side. So thinking about as families are navigating different systems, what does that look like as far as data sharing and screening and assessment? We used this cohort as an opportunity. I saw Sherry Williams on here to think about other opportunities. So we are doing something through Imagination Factory with another partner. We're bringing partners together to talk about, have sort of a shared space around roles and where we can use resources more efficiently, which hopefully will lead to some resources around training our child welfare staff. And so I'm really just thinking about solutions together and acknowledging that we don't, I'm from the child welfare side. I don't have to have all the solutions, but we can hopefully work together to do better for families. So thank you.
Thanks, Mary. All right. Well, thank you to all of our panelists for starting off this section with so much rich information and context and kind of an overview. I'm going to invite Krista Thomas with Chapin Hall to join me to kind of co-moderate as we move through the discussion with our panelists. Krista, do you want to introduce yourself?
Hello, everybody. Yes, thank you for having all of us today. I'm Krista Thomas, and I'm a senior policy fellow at Chapin Hall and also a co-lead of this cohort with these fine colleagues on the line today. Back to you, Andrew.
Yeah, so to start, certainly if folks have questions, you can put them in the chat, and if we don't get to all of them, we may respond in writing or figure out ways to integrate follow-up. But I want to start with a question for Janelle. You referenced, there's a longstanding history of, and we've certainly seen that there's a longstanding history of successful child welfare and housing partnerships and progress in New Jersey. How have leaders from across your state agency partners been able to really maintain and strengthen your coordination and leverage the partnerships and the data and messaging as a part of that to maintain support and continue scaling your work?
Thank you, Andrew. I think one of the most important things that we've been able to do across across DCA, across the Department of Children and Families and the Department of Human Services has really been to engage in some very intentional partnering and making sure that that's being engaged in at leadership levels. And I know Andrew and CSH were with us in the very beginning as we started on some of these discussions. And in many ways, one of the ways we started was just by understanding, what services, what resources we each had and where there might be some duplication of effort or replication of services. And that's a great thing to start with because people are always interested in well, where might someone else be paying for this so I don't have to anymore? And we did find that there were some areas, but I think no one will be surprised to find that we also found there were a lot of gaps. And that really led to the development of some programs. But I think in engaging in that partnership, we made sure not to limit it to a specific project. We kept doing it. All of us at, who've been engaged in this have been in government long enough to have been through some very good times and some very challenging times. But even during those challenging times when there really wasn't much hope of getting, new budget, new money, we made sure that we connected because we wanted to better understand the common populations that we served and what each of our systems look like, because they are complex systems on each part, they change. And even now, I am always finding out something new about one of these systems where I'm like, oh, I did not know that worked like that. Or that's what that part means. I thought it meant something else. And we've also really engaged in a lot of sharing of data, especially knowing our common populations to really think about, who is out there? What are we doing for them? What did they need? And what that means is when opportunity does arise, we can react very quickly. And we can also proactively steer some efforts to make sure it's going to bring us the biggest impact for what we want to do. And so some of the things we've been able to do with that is we have a partnership with our Division of Medical Assistance and Health Services at Human Services. They run our NJ Family Care Medicaid program, where Healthy Homes Initiative, where we are providing $100 million for developers to develop units that are reserved for extremely low income individuals and families in NJ Family Care who couldn't otherwise afford affordable housing. At DCA, we fund affordable housing. So we are engaging with our developers. We're able to offer them these funds from Human Services, and we also match that with some operating funds. So we are able to really design a program that our developers are really taking advantage of. And especially right now, as some other sources of capital are drying up, we're seeing more and more uptick there, which is creating more extremely low income units, which in New Jersey is crucial. We also are engaging with Medicaid in their housing supports program through the Medicaid 1115 waiver. And we partnered with them as we discussed what will be covered. And we are also administering funding that they have to build support to be Medicaid billers among our homelessness services agencies, because we know they have a lot of this expertise we knew, but many of them were not engaged in that. Something I'm also really excited about, and I have my fingers crossed that this goes through by the end of the month when our budget is signed, is based on a lot of the data and storytelling and stakeholdering that we were able to do together. We have an additional $25 million included in our state budget this year for a homelessness response initiative that is going to allow us to provide additional services, operating support, et cetera, for families and individuals in some of our key zip codes that have the greatest level of need. And we're going to be working together with all of our state agencies to implement that. And so we're really excited about that. And something else that we're working on and we'll be continuing to work on is really using the elevated data we're able to share with each other to do some data modeling. We're really able at this point to really explore at the zip code level what certain changes and what certain differences in federal policies and different budgets, what impact they're going to have both on the people we serve, but also economically on our state. So one thing we're engaging in right now is working on looking at changes in, for instance, the HUD continuum of care NOFO. How will that impact people in our state who are homeless or at risk, whether they're already in the system or not? But also, how will that interact, say, with the impacts of changes to SNAP or to Medicaid with additional work requirements, et cetera? Will we see more homeless people? Spoiler, yes, we think that we will. What will that look like? Where will we see those impacts? How can we move to respond to them quickly? And also, how can we tell the story to our legislators, our officials, our stakeholders, so that they can help us manage that response?
Great. Thanks.
Terrific. So I think we're going to pivot and I'm going to ask Stacy some questions in Oregon, but also trying to be mindful of some of the questions that are starting to come into the chat, so we can try to address a couple of those at the same time. But first, before that, Stacy, you've got a really unique and intentional position that's existing at the intersection of child welfare and housing. And I imagine there might be something that's really interesting to other states that might want to do something different or do something similar to that. Could you share a bit about what your position is and how it came to be and where it sits? Because I think operationally that might be helpful for some folks.
I think a little bit. I don't as it's there's some mystery to it because I know it started way before the position actually came about. I think that there was some advocacy over the years for this position, understanding that we didn't always put it together like in an intentional way. I think there are great examples from around the state about how the communication has occurred and how the collaboration has occurred, but intentionally as a state in child welfare, we haven't done everything we can to make sure that housing is on the forefront. And so when this position came about, my boss, who runs our Family First program was just really excited to say, absolutely, this fits on our team and this really fits with what we're trying to do next. And figuring out ways in which we can collaborate and overlap. And it also facilitates different connections we have. And so sometimes, again, I am not the one that's the expert on the evidence-based practices. I know something about them, but I'm not the expert. But they're able to bring me into a room and have these conversations about housing. And one gives me knowledge because it gives me the capacity to have some conversations and make sure that I'm advocating for and representing people that are actually on the ground doing the work having those interactions and so that I'm not out of touch with what is going on there. So it helps me in that way, and it helps them because then I am able to make some connections with what housing programs we have, in terms of contracts and other things, but also helps me make direct connections with our like Oregon Housing and Community Services program that is our housing agency in Oregon. And so again, it's that we didn't have that person that could always make those connections. There's a couple of us. There's somebody who's a policy analyst that does this for DHS overall. And then there's me that does it for child welfare. And it's really helped to be able to put those pieces together. And it's taken a while to really develop some of those relationships. But now it feels good that I know who to connect people to, that I know that I can give somebody a quick answer, that I can get on a call or connect them to somebody in a way that it might have kind of stopped somewhere because they hit some roadblocks in the process. So I do believe it's been helpful, and I hope we figure out ways to keep it moving forward because I think we need it.
Thanks, Stacy. Think, we've been looking at some of the questions coming in as well and are kind of trying to integrate into some of the responses. Evan, kind of thinking about Colorado again for a moment. We know you've taken a number of important steps. You're within a context that's a state supervised, county administered, human services kind of program. Yeah, would you be able to share a little bit more about how kind of working across systems and agencies, what's kind of allowing some of that coordination and what's contributing to some of that alignment or success?
Absolutely. It's such a good question. And I think one of the things at Colorado we're always trying to learn are what are those opportunities that we have being state supervised, county administered for child welfare. I think for us, one of those spaces that we're really exploring is the ability to do the convenings and have the shared plans and strategies across our network of providers, whether they're county administered or whether they're working with a local nonprofit. And so a lot of what we heard and thinking about our learnings within the cohort in particular were what were those opportunities. So I think for us, what we really wanted to highlight were what we were trying to focus on around engaging our young adults and people with lived experience. So in our Reimagining Child Welfare group that we were trying to stand up and continue to take ideas and model off of, that's a space where we can really bring in partners across the state, whether from urban or rural communities, and learn what that experience is so we can build both capacity at the local level, but then also drive the policies and strategies at the statewide level. This is all under the guidance that we have in Colorado, which is our governor's directive to make homelessness history in Colorado. So this is how the states convene together. We can share that learning and then learn directly from the experience of those who are receiving either housing services or experiencing child welfare involvement in ways that we can really strategize and meet the needs of local communities. And so such a good question as we're really trying to find what those opportunities look like. One of the examples that we were highlighting was the Colorado Fostering Success Housing Vouchers. We saw, and one of the chats were also noting this too, that there are differences in definitions around homelessness, in particular at the federal level. And so one of the things that we really needed to highlight at the local level and here in Colorado was to develop a imminent risk of homelessness to meet the needs of our youth as we were able to deliver those vouchers, in particular to identify youth who are leaving our Division of Youth Services, who would be good fits for the program, who would be really appropriate in finding and moving upstream in our supportive housing opportunities to really meet the needs of those young adults. And so that was a space that we really engaged our Colorado Fostering Successful Transition to Adulthood Advisory Board to help us develop that definition to really make sure that we were meeting the needs and not missing one of those at-risk populations in particular. One other piece that I wanted to highlight as well is that all the work that we're seeing in Colorado, and this goes to a point that Janelle made, is being driven through data and learning that we've made here in the state. So just 2 points that we want to highlight as part of this. One, last year, Colorado, we released our first State of Homelessness report, which was an important opportunity for us to actually leverage our continuum of care data using our Colorado HMIS, Homeless Management Information System, to look at the needs across the state and really identify what is that total total number of Coloradans who are experiencing homelessness. For the second year, we've been able to release that report, and it's going to help continue to drive how we're engaging locally and then driving the strategies at the statewide level. The other report that highlighted this was we shared a report on building a sustainable and replicable approach to estimating the prevalence of youth homelessness between the ages of 14 and 24 in Colorado, which was published in January of 2025. This looked at youth that were engaged with the Colorado Department of Education, Homeless Management Information System, and Division of Child Welfare to see where were those youth in an unduplicated count showing up in all three systems. It may be unsurprising for folks on the cohort that of the 42,000 unduplicated youth that we saw over the 5 state fiscal years we looked at, only 10% of them showed up in actually all three of the systems. So we recognize that each one of those systems of care is not always meeting the needs of the population. And this is where we really need to work, leverage our local partnerships, and lead at the statewide level to really address this critical need across the state.
Great, thanks. And I'll just reference, I know we're a couple minutes from the top of the hour. We are hoping folks can stay with us for, I think we're willing to stay on or able to stay on for about 10 additional minutes to continue discussion. We also, just if you do have to jump, we'll be sharing an email with the recording. There's contact information and additional resources, and we'll be looking at the chat questions too if there are things we didn't get to. But I think with that, Krista, do you want to help us continue the conversation?
Oh, I'd be happy to. And I know, Mary, you might be a little bit on borrowed time, but definitely want to give Kentucky a chance to jump into this discussion. You all really did lean into the momentum that was generated by the cohort and have been focusing on trying to sustain that momentum and keep these going and strengthening your local partnerships. How is that effort going so far? And what are your goals for trying to keep the focus on the housing and child welfare intersection in place going forward?
Thanks, Krista. I think for us in Kentucky, the goal is really just to continue the momentum, and and you know this about me, that I'll be the first to say that I was initially really sort of hesitant for the Child Welfare Agency to sort of lead the charge in this space, because we are the Child Welfare Agency, and so we sort of jumped feet first into leading, pulling our partners together. But then, I was like, is this really what our role should be? Because we are the Child Welfare Agency, and I really feel strongly that we should be intervening earlier for families. But we are, like I said earlier, we are serving the same families, and, I do feel strongly that we should all be at the table. And so, and it is leading to other opportunities. And so for us, the goal is really, to, bring partners together, share strategies, learn from one another. Janelle shared about Medicaid, and we have some similar strategies happening in Kentucky, and so it's really about that, and doing what's right for families. And so we're convening regularly at this point, and at least consistently, I'll say, and with the goal of trying to get some data sharing going on, and talking the same language. And in the beginning, we shared Chapin Hall's research, and to really try to set some groundwork for how our housing partners and our sister agencies, and now we're just coming from a place of learning and trying to be more intentional. So that's what our goals are. So thank you.
That's terrific. And I'm realizing that we are now officially a minute over the hour, but there were a couple of questions that came into the chat that I wanted to put out there for anybody that wanted to jump in. We did have a question about 10 minutes ago from Jessica, who was interested in whether or not any of the housing programs and interventions are really focusing on culturally appropriate services. As part of your housing and child welfare collaborations, are there particular elements that any of you would lift up that are attending to cultural responsiveness or the unique needs of different communities? And that's an open question for anybody that might want to speak to it.
I'll mention, and I saw Janelle on mute too. I think it's really important. We're with our work with the Imagination Factory work, just being sure that you're engaging the community, like individuals with lived experience, and that's really what we're trying to do in Kentucky, and really having them at the table. And that's what our focus is in Kentucky, and having them involved in the strategy. And so for us in Kentucky, that's the primary focus as far as what works for that community.
I think one thing that we've really learned from our partners at the New Jersey Department of Children and Families is about really engaging and elevating family experiences and family voice, not just as kind of an add-on or an advisory part of a program, but really being embedded in the development and the improvement and enhancement of systems. Our DCF really engages in a lot of work that way. They have an Office of Family Voice that is focused on that for all of the programs. And we really, in working with them and seeing what that added to the programs, was really, I think, enlightening. And we now engage at DCA with our own Council of Lived Experience around our housing and homelessness programs to try and echo that as well as engaging the Office of Family Voice when we were working on projects that impact child welfare.
I know there were several questions that came in around kind of intergenerational connections or bridges, kinship care, and kind of some of those bridges and how you all might be, has there been any discussion or leaning into or progress around strategies related to kind of any
One thing I noted there was a question that touched a little bit on, when people need more space, or I know here we see sometimes where there might be families, grandparents, et cetera, who are living in housing that is maybe aging or, might be lead exposed or things like that, that really needs to bring safety. And I think one thing that's been really important for us is making sure that all of our partners are educated on all of our existing systems and resources so that instead of trying to scrape together money to like do this is this agency's program to address lead, this is this one's, we really can engage people in the resources that are already out there. We have resources that, will help to repair homes. We have resources that will help to address and abate lead. We have some of those resources, but a lot of folks, who don't engage with DCA, engage more with other agencies, aren't aware. The more we bring them in, and the same thing for us to know about those child welfare programs that are available, so that as we see people who might have a struggle that we don't have a specific resource for, we can connect them with what exists. And only once we make sure it isn't existing out there can we look at saying, well, what do we have to make anew?
When the money's gone, the money's gone. Fantastic, Janelle. Thanks. And maybe to close us out, one final question for everybody. In thinking about other jurisdictions that might also want to make housing central to their family well-being efforts, what advice would you give other jurisdictional leaders that maybe want to go down the similar path that you all have in your jurisdictions? Any guidance or concrete next steps you would offer?
I can jump in. So I think a few things that all the states have been able to touch on is the importance of how we're able to inform decision makers, especially those in state government, on how we can leverage those with lived experience as part of the discussion and opportunities. And so we've heard many examples across our state partners today that we can really think about how to make actionable some of those recommendations from advisory boards, especially here in Colorado. That's been a huge huge emphasis. And I think one of the spaces that we will always encourage jurisdictions as you're thinking about that to really see what strategies are out there, what are already being recommended. This speaks a little bit to the interagency partnerships. And so one of the things that you're hearing from a lot of the states as well, I think today, is that what are those opportunities where you can see some cross-state agency collaboration to fill in those gaps or identify where those gaps even look like. And so that's a space, especially as we see challenges at our federal level of what may come down, and we have to make difficult decisions around what priorities we have as a state. The ability to stand with the other state agencies to have those aligned programs and approaches is a space that I think we're really coming to the forefront during the cohort conversations, and something I would really emphasize for you as you're thinking about this in your jurisdiction to how to implement some of these ideas is to really lean into that opportunity to see what sort of other work is already happening across the other state agencies, find time to convene that together, and also make sure you're leveraging and really strengthening those recommendations that you're getting from people with lived experience within the processes as well.
Fabulous, Evan. Anybody else?
I think you summed it up well. Yeah, just
Yeah, that's great advice to act on.
partnerships and lived experience, and look at your data.
Awesome. Well, I think with that, we can move to closing out. We certainly want to invite everyone. Thank you for staying longer to be a part of the conversation. Think about at least one concrete thing that you'll do following the webinar. What's one thing you can do optimizing something that exists, exploring new efforts? Take a look at that housing menu worksheet within the state report, kind of think about identifying what family housing options exist, what cross-sector data could you leverage to utilize unmet family and youth housing needs? What conversations might you be able to have to connect and learn with other partners about addressing housing as foundational family well-being? How can you connect, as Evan was talking about, with family, parent, youth leaders, other systems, other organizations? Think about, who are those trusted partners and communities. Many of you, as you were signing on, we saw, community action agencies, family resource centers, early childhood, other community-based assets, really, and how can those state, county, and kind of those community assets where people can really engage be continued to be leveraged in intentional ways and grow forward. How can you realign or leverage funding, even in this atmosphere to effectively operationalize programs that support stability and well-being. And there's more resources that all three of our host organizations have at CSH, Chapin Hall, and Casey Family Programs. So we invite you to check those out. Like I said, the state report, actually an appendix, and the appendix at the end, there's additional resources from each of our organizations that we would encourage you to take a look at. And then we invite you to connect with us, and you can see contact information. I know folks in the chat were asking for contact information. So for our three national organizations, you can reach out to our team at CSH at the email address, oneroof@csh.org. Casey Family Programs, Chris, who spoke earlier, is a good point of contact. KISUM@casey.org. And then for Chapin Hall, Krista is good contact, ktomas@chapinhall.org. We'll be, again, sharing the recording and an email with basic information.